We've all woken up one morning and not recognized our surroundings, whether it's from a deep sleep in our own room, an unfamiliar area from vacation, or at a friend's house. While it's a bit startling at first, we can usually reorient ourselves and recognize where we are, whether it's our own bedroom, a friend's room, or a hotel room. For those people with Alzheimer's, they're unable to recognize their surroundings after a few seconds, even if it's a place they've lived for many years. Alzheimer's has a big impact on those with the disease, as well as those closest to them, whether it's family, friends, or people caring for them in an assisted living facility. Many of you know someone with Alzheimer's or will know someone in the future. I have had grandparents on both sides of my family diagnosed with Alzheimer's. Today, I will establish what Alzheimer's is, what the signs and symptoms are, and what treatments are available. Starting with what Alzheimer's is. Alzheimer's disease is a neurodegenerative disease that is the most common form of dementia. Alzheimer's has a great impact on the brain. It's a progressive disease, meaning it continues to spread and gets worse as time goes on. Alzheimer's can affect a person's thought, memory, and language. And according to an article by the CDC, over 5 million Americans had Alzheimer's in 2014, and this number is expected to rise to 14 million by the year 2060. Alzheimer's symptoms typically emerge after the age of 60, and the risk for developing Alzheimer's increases as that age increases. So someone who is 75 has a greater chance than someone who is 60. But Alzheimer's appearing after the age of 60 is called late onset Alzheimer's. However, Alzheimer's can appear as early as age 30, and in those patients, it is called early onset Alzheimer's and can range from 30 years old up to 50 years old. So, moving on, what are the signs and symptoms of Alzheimer's? There are many warning signs family and friends notice in the changing of a behavior of a person with Alzheimer's. Friends and family typically notice first, as they're the ones who see this person on a day-to-day basis and are accustomed to how they act and behave and what they should remember and what they don't remember. So many Alzheimer's symptoms cause a disruption in this daily life of those suffering and can have an impact on their family and friends. Alzheimer's can cause a loss of memory, and they'll need reminders for simple tasks around their house. They misplace items often and even forget important dates such as birthdays or anniversaries that they've known for many, many years. Mood swings and personality changes can become common and are noticed by the friends and family. Other more severe symptoms can be noticed by those who are not close to a person with Alzheimer's. Alzheimer's can cause spatial perception issues, and this can lead to tripping, falling, and dropping things, whether it's in public, and other people around them can notice that. Impaired judgment as a result of Alzheimer's can cause many problems like poor money management, the inability to care for a pet, and the lack of personal hygiene. Poor money management means people with Alzheimer's don't spend money the way that they should, and they are also more susceptible to scams, whether through emails or phone calls. They don't understand that they don't know the person on the other side of the computer or the phone, and they'll send them money even though they really, really shouldn't. The inability to care for a pet, even if they've had it for many years, can come from forgetting to feed them, take them for walks, and the basic maintenance of these pets that they've had for a long time. They also won't take part in as many events and activities that they previously enjoyed. Keeping up with sports is a bit more complicated, and they don't understand what all is going on, so they don't find as much enjoyment in it. They're also unable to recognize their friends or family members at a church function or different events or country clubs, and it's hard for them to continue going to these events and interacting with people who know everything about them and they can't even remember their name. So what are the available treatments for Alzheimer's? Drug treatments, non-drug treatments, and a combination of the two are often used in treating those with Alzheimer's. There is no cure, so there is no drug that can completely stop Alzheimer's. Instead, the drugs are used to slow down the process and manage the symptoms. The medications used in the early to moderate stages are ridazolam, Exelon, and Aricept. These drugs are cholinesterase inhibitors, and they reduce the breakdown of the neurotransmitter acetylcholine. Acetylcholine is a neurotransmitter important for memory and thinking, and Alzheimer's attacks it and lowers the production and eventually stopping it. So these drugs aren't no longer effective once the Alzheimer's stops the production of that neurotransmitter. So for more moderate and severe stages of Alzheimer's, the medication Namenda can be prescribed in addition to those previously mentioned or on their own, as it works differently and it targets the insulin production and distribution in the brain, instead of those neurotransmitters. There are many non-drug treatments that are also effective on their own or in combination with the drug treatments. Many doctors will encourage non-drug treatments for Alzheimer's before trying to start a drug treatment. Memory training and stimulation, physical activities, and social stimulation are great non-drug treatment options. Being physically active helps prevent Alzheimer's patients from becoming bedridden. Memory training and stimulation and social stimulation helps them to keep their cognitive abilities up. And cognitive therapy is also used to improve thinking and memory. Arithmetic and memory games, puzzles, and practice in daily activities such as going to the supermarket or to go get a haircut. Reality orientation can also be used to help with memory. Labeling rooms in the house, appliances, counters, spaces, cabinetry, and putting up calendars and clocks around the house helps provide a sense of independence for those living with Alzheimer's still in their homes. There's a lot of chance for frustration if a person is unable to complete a lot of day tasks by themselves. So using these tools can help to prevent getting frustrated in that sense. Music can also be used as a therapy for those with Alzheimer's. Music often triggers memories of when they listen to that particular song or of a time that song reminds them of. A great documentary called Alive Inside went really deep into music therapy, and the results were amazing. Patients who never talked or showed very little interest almost seemed to come to life when listening to music. They could sing songs from their childhood, and they would be a lot more engaged in their day-to-day lives. My great-grandfather loved hearing about songs from his teens and early 20s when he served in the Navy, and a lot of the men in his unit would also respond to those types of songs, tapping their feet, bobbing their heads. And not only does music therapy help improve cognitive function, music therapy can also help reduce depression, anxiety, and improve overall mood of those with Alzheimer's. So first, we looked at what exactly Alzheimer's is. Then we examined what the signs and symptoms are. Lastly, we looked into what treatments are currently available. And as I said earlier, a projected 14 million people by the year 2020 are expected to be diagnosed with Alzheimer's. Your future career could be more related to Alzheimer's than you might think. If you become a music therapist, you could have a patient with Alzheimer's. If you choose to do the medical field, you could work closely with someone who has Alzheimer's in an assisted living facility, or a STEM field scientist could research possible genetic causes for Alzheimer's. Now, caring for a parent or grandparent with Alzheimer's might be really far into the future for